Hi, this is Dr. Pamela Smith. I direct the Fellowship in Anti-Aging, Regenerative, and Functional Medicine. I'd like to invite you to become part of the Fellowship. Today's medicine really is about a personalized approach for each and every patient. Module 1 looks at hormonal balance for patients at any age. Module 2 looks at cardiovascular health from the viewpoint of high cholesterol, high triglycerides, high homocysteine, high TMAO, and much, much more. What do you actually do with those tests when they come back? On Monday morning, you will be able to, in Module 2, walk away with the information. In Module 3, we very importantly look at neurological health and psychiatric health. So many of our patients have neurological issues, and they have anxiety and depression. They have insomnia. Module 4 is very important from the viewpoint of gastrointestinal health. The patient's gut's not healthy, they're not healthy. Also, vitamin B12, vitamin K, biotin for hair and nails are all made in the gut. I can't say how important GI health is. If you ask me, is it more important to have the patient hormonally sound or have their gut healthy? I will tell you, I don't know. They're equally as important. Module 5 puts it all together. I love Module 5 because all the professors bring their own case histories to discuss, and we examine it in a very one-on-one and personalized approach where the people that are the participants can ask as many questions as they would like. In Module 6, we examine infectious disease. We look at mold, cytomegalovirus, Lyme disease. There's a huge increase in Lyme disease, which can lead in secondary and tertiary Lyme to cognitive decline, gut disturbances, neurological issues. We examine all that with world-class professors, including Dr. Richard Horowitz, the #1 professor in the entire world in Lyme. In Module 7, we look at autoimmune diseases from many perspectives. We're very blessed to have professors like Dr. Jill Carnahan, Dr. Lynn Patrick, and really looking at things from the perspective of autoimmune, which now there are 105 autoimmune diseases. Dr. Philomena Trindade, Dr. Sahar Swadan, all of them have input from their different perspectives on how to help autoimmune diseases. In Module 8, well, we put it all together. We look at nutritional depletions caused by medicine. Dr. Rosenberg is fabulous looking at cancer therapies. We look at really sports medicine. A lot of your patients out there do what I call aggressively exercise. When people aggressively exercise, they deplete their body of mitochondrial nutrients. Please join us in the fellowship. It's important to look at all these things in your patients. It's a new perspective in medicine. It's a great time to be a patient. It's a great time to be a clinician. So no matter whether you're a gastroenterologist, you're a family practitioner, you're an ophthalmologist, a naturopath, a nurse clinician, a PA, or anyone else involved in healthcare, the fellowship is for you.